I was originally brought here to open up the bone marrow transplant program and have been doing that now for the last, I guess, 17 years. The reason I'm talking to you today, though, is to really speak more about an outreach effort that we have as part of the opening of the North Carolina Cancer Hospital and UCRF. And the reason that I'm involved with this is that I thought several years ago that not only would this be a good service to the state, but in my own role as primarily a referral-based physician, I've known many of the oncologists around the state for a long time because my business basically requires them to refer folks into me for different treatments regarding their usually hematologic cancers. For that reason, I felt that working with doctors in the community would be a helpful thing both for us and also for the patients, not only for transplant, but for many other components of what we do here at the Cancer Center involving delivery of care as well as education. And so the outreach program that we've developed over the last now probably year and a half or so involves several different functions. There's an educational component to it in that we hope to develop a system whereby programs will be available throughout the state, primarily by video conferencing and by a telemedicine network. This will allow us to provide ongoing educational programs to not only physicians in the community, but also potentially for lay people such as patients and family members, as well as other providers, whether it be nurses or pharmacists or other groups that could collaborate with the ability to actually interact with us through a video conferencing system so that they'll be able to stay in their community, but we'll be able to project programs here from this room actually here in the North Carolina Cancer Hospital. Some of the other components of what we're talking about would be the potential for having some outreach clinics, and the idea behind this is that specialized care such as transplant sometimes can involve a fair amount of work at home before patients actually get to UNC for their transplant. The idea being that we might be able to see them, say, yeah, this is the right thing to do, let's work on this over the next couple of months, and then come up sometime 2 or 3 months from now, that would be the time that you should actually be admitted for your transplant. And then subsequent follow-up could be done partly at UNC and partly here in the communities that you're coming from, so that people wouldn't have to travel quite so much. And then the last thing has to do with a telemedicine and a video conferencing program that we're putting together that is really focusing more on what we call tumor boards. At UNC, we've been fortunate to have a large enough faculty that people focus on specific areas of cancer. So there's a group that works really only on breast cancer, another group that works only on lung cancer, a group like myself that works mostly with hematologic cancers, leukemias, lymphomas, multiple myeloma diseases like that. And the goal behind these conferences are that we realize that in the community, generally there aren't enough physicians in any practice to have that level of focus on a particular area. So what we're hoping to do with this is provide long-distance consultative services where physicians can send in information about their patients. We would then review it in a tumor board format so that there would be then the experts here at UNC, both from pathology, medicine, surgery, radiation oncology, radiology, all looking at the cases and then discussing it with the referring physician so that then he can turn around and decide whether or not the treatment that he's giving now is the optimal one, whether he wants to continue that, whether he thinks that something different might be useful, whether, for instance, there may be a clinical trial that would be available at UNC that would be worth referring a patient up for, or not. And I think that the idea behind this is that we'll help educate the community physicians on what we think is the most cutting-edge care. At the same time, we'll be able to provide this kind of consultation for patients without them having to travel up here, for what may turn out to be simply a acknowledgement that the care they're getting is excellent and they didn't really need to make the trip. On the other hand, there are going to be patients that I think would benefit from coming here, and hopefully we can sort that out without them spending the extra day or two traveling to come back and forth and disruption from work and things like that. I think this will be a nice collaboration with not only patients and families in these various communities, but also with the physicians who would refer their folks. That way they get to keep the patients closer to home. It's less disruptive for the people themselves, as well as the fact that they're then remaining in contact with the providers that have been giving them their care all along. So I think that's a nice way for us to use the services that we have.